Hi, my name is Dr. Bridget Guidry. I am an optometrist at Iberia Vision Center, and I have been in practice for about 8.5 years, and I have a few questions to answer for you guys. So I'll get started. I know we don't have a lot of time. So how much training and schooling is needed for this job? So about 8 years. You need 4 years of undergraduate work with prerequisites, and then you need 4 years of optometry school. At this time, a residency is not required, but you can still go on and do residency to specialize in different things. But so about 8 years is right now what you would need. What high school classes could you take to prepare for this occupation? So you need a lot of sciences, of course, such as biology, chemistry. Physics is very important. There's lots of classes called optics in optometry school. Most of it is just physics. So those types of classes would get you where you needed to be to get into optometry school. What is the job market for this occupation? Well, I'd say the job market in Louisiana is pretty good. We do not have a school in Louisiana for optometry, so I think that puts us in a good position. A lot of people are not going to go away to school and then come back and come back. Some of them do, but optometry school is a little harder to get into because there's not as many as med schools around the country. There are only about 21 optometry schools, again, none in Louisiana. So I think the job market is pretty good for us here in Louisiana and South Louisiana. So. And what is the starting salary for this occupation? Well, it just depends on what route you take. There's private practice optometry, there's owning your own business or your own practice, there's corporate optometry, which is working for big chains like America's Best, Target, those types of things. So depending on what avenue you take, it kind of depends. But average salary, I'd say, for a young optometrist would be probably close to $95,000 a year, or about $60 an hour. That would be fair for someone just getting out. And what personality traits are needed for this occupation? Well, we just have to be able to work with different types of people. We work with the public, and I think that I'll kind of put that into the next question. How much interaction do you have with the general public? It's a lot. I mean, that's what we see. We see patients every day. The number one thing is having a lot of patience with our patients. We see a lot of kids, a lot of adults, a lot of elderly. We see all ages. So some people come in very nervous. We have to keep them calm, and some of the kids are a little rowdy. We have to take our time with them. So personality, you have to be able to work with all different types of patients. So that's the main thing. So, and what is the time demand for this occupation? Well, again, depending on what you do. In private practice, it's usually like a regular medical office. We work basically 8 to 5 most days, no weekends. If you choose corporate optometry, which is, there's, like I said before, like LensCrafters, America's Best, Target, those types of things. A lot of those do work weekends, Saturdays at least. So it just depends, but most of the time it can be just a 9 to 5 job during the week, which is great. Okay. And the next question, I'll kind of show you guys some stuff about it. Can you explain a typical day in the life for this occupation? Yes. So it's really neat for us because a lot of people think optometry, it's glasses and contacts, and that's a big part of what we do, which is great. It's very, very rewarding, especially when you give a kid their first pair of glasses and they walk out and they can see. I mean, it's amazing. I love what I do, but it's more than just glasses and contacts. We also check the health of people's eyes. We can find different eye diseases. We can, things like bleeding in the eyes from blood sugar from diabetes, blood pressure issues. We can tell if someone may have an aneurysm or a tumor behind the eyes. So there's lots more than just glasses and contacts that go into it. So when you come into the office, the first thing we generally do is we'll check your vision, see how you're doing. We'll check your eye pressure. Some people may remember the puff of air. Everybody seems to remember that. There are other ways to check it as well, but the puff of air is just checking your pressure, just like blood pressure, we have eye pressure. That's something we do. And then we usually bring you into the exam room and we check your vision. So with our phoropter, that's what this is called, phoropter with a PH. So this just helps us to get your eyeglass prescription, and we flip. There's hundreds of lenses in here that we can flip and find what works for you to get you to see your best. And this here is a slit lamp. So this is just like a big microscope with lights, because your eyes are very small. Everything in your eyes is very small. So we have you put your face in here, and we're able to look in the eyes and at the eyes with a very magnified view. So the other thing we do, and this is the fun and cool part for me, is I get to put this thing on my head, and it allows me with a big magnifying glass, super magnifying glass, to look inside your eyes to check for things in your retina, which is the back of the eye. We get a good detailed view of that to look for diseases or irregularities or anything like that. So it's a very cool profession. I love what I do. You know, schooling is a long time, or it sounds like a long time, but it's worth it, because you could either spend that time in school and have a lifetime of something that you love to do, or you could just go to school for a short time and do something that you're not as happy with. So I hope I was able to answer your questions. If anybody ever wants to shadow or talk to me, you're welcome to. Just give me a call, and I hope I've answered all your questions. Thank you.